So definitely it's a new experience looking at the computer. So hopefully everyone's staying safe in this time, and that you're starting to kind of wander out a little bit and see some of the beautiful weather that's happened over the last few days, and getting ready for the impending spring that's going to happen, whether we're experiencing social distancing or not. Louise is right. The social distancing has been hard for me. We're doing lots of, we call them virtual hugs, virtual handshakes, that kind of stuff. So yeah, anyway, let's get on to one of my favorite things. The future of veterinary medicine, especially the sports medicine side of things, is going to be regenerative therapies. And if you've been to see us before or been on rehab cases, we talk about this a lot, right? So PRP, IRAP, and stem cells. Let's talk a little bit about what is platelet-rich plasma. I mean, everybody, it's the big catchphrase right now, been pretty hot for probably about 10 years, but really the last 5 years, it's really been catching on. PRP is made of your horse's own blood. And it's kind of, I'm just going to read through these a little bit. Platelets stimulate cell growth within the body. Platelets are a cell that plug up blood vessels when your horse begins to bleed. When platelets arrive at the site of the injury, they release growth factors that encourage tissue to regenerate. They encourage new blood vessels to form, bringing oxygen and nutrients to the damaged tissue. Okay, so if we're really thinking about why we use them in the athletic injuries that we use them in, the two bottom ones really ring through, right? The release of growth factors that encourage tissues to regenerate. So if you think of a lacerated vessel or a damaged blood vessel, that's what you need. And that's why platelets show up there to plug the hole, but they also show up there because they're kind of the repairman or the repair woman, like, so that they can put that blood vessel back together and get that blood flowing into that area. They encourage new blood vessels to form, bringing oxygen and nutrients to damaged tissue. If you have a soft tissue injury or even a joint injury, you really want those things to happen, right? Oxygen and the nutrients to be there. That's what's going to bring about cell regeneration. It's going to help us get a better healing. Maybe not necessarily a quicker healing. I want to make sure that we're careful with that. That's one of the things that we get into is if I use platelet-rich plasma in my horse, is it going to be quicker to recover? Possibly, but not necessarily 100% that way. We do hope that by using PRP in our tissues that we get a better healing. Okay. Let's just go on a little bit here to a couple of things because we get these questions all the time. So PRP, platelet-rich plasma, how is it harvested? In that picture there, you can see a really kind of a complicated looking machine. It's called an angel draw. There are myriads of other ways to do platelets as well. The most simple one is just to take your blood, take the horse's blood or your own blood, because we have the same kind of thing going on, and so do cats and dogs. You just draw sterilely, and you use some sort of a centrifuge, because that's what that machine in the picture is. It's a very complicated centrifuge system that allows blood to be spun so that those heavier platelets can concentrate at the bottom of the tube, or at the bottom of the draw. Okay, so when we're doing this, if we spin, because the platelets are heavy, they tend to marginate or move to the outside of the tube or the collection container, and then we're able to harvest them. And just think about it for a second. As most regenerative things are, we're just trying to mimic or mock whatever's going on in the horse's body or your body to start with. So in this situation, we're going to take the platelets from, let's say, I don't know, 15 or 20 cc's of blood, and then we're going to try and concentrate them into like 2 or 3 cc's or 5 cc's, so that we end up with what we call platelet-rich plasma. Okay. What are we treating? Generally use joint injuries and osteoarthritis. All injuries that are often slow to heal. Okay, that's a big part of it. We want to use this in an area where there's not necessarily the best blood flow. So if you look at the hands of the veterinarian doing the injection, that's going into the proximal suspensory region, which is a very, very common area for platelet-rich plasma to be used. There's several factors, but one of the really leading factors is the fact that tendons and ligaments just don't carry a lot of blood supply inside of them. They do have blood circulation around the outside or through the tissues that are surrounding them, but because they don't carry a lot of that, it's hard to get the concentration that you're looking for. So by harvesting it off and then, like I said, concentrating it, you can put a smaller volume next to it or right into it, and it allows those tissues to get the healing factors that they want to get naturally. And what's really cool about it is We're just using the horse's body. We're just taking it out of one place and then concentrating it with some sort of technology, and then just replacing it back into an area where there's been an injury. Okay, joint injuries, same thing. The joint itself actually has a lot of blood supply around the outside, but there's not a tremendous amount of blood supply inside of any joint, right? It's usually just around the outside. So osteoarthritis, same thing. We put that plasma inside that joint, it's going to diffuse out. And you guys know that osteoarthritis is a combination of the joint fluid, and the joint capsule. Okay, and when we put that plasma in that joint, it marginates and gets outside into that joint capsule within about usually 24 hours. Most of it's gone and into the soft tissue being used to heal the damaged areas there. Okay, so the angel system that we talked about a little. Did I go? No, I'm still. Yeah. Okay. That's all right. That's all right. Wheezy and I, we're going to just keep moving through this. So angel system, a couple of things. Let's just talk about a couple of things that are happening, because in the old days, you just drew blood, you could put it into a tube and spin it in your centrifuge that you used for blood work, and you'd have some pretty decent plasma, to be honest with you. But over the last few years, because this PRP has become so intricate, especially in the human side. This is a human machine, right? And in human medicine right now, this is on fire and has been for a while on the athletic side. There's a golfer, his name's Tiger Woods. About 10 years ago, he had his knees injected with plasma, and he was talking about how much better he felt. Starts being more professional athletes. And so as it starts to kind of get into the, into the, what we call the mainstream of people that are popular, I guess we could say paparazzi or whatever, that really brought it to the forefront for the rest of us, even though we've been using it as a modality before that. So it's a revolutionary production system, because PRP formulations could be exactly tailored to specific needs of the patient. We're getting to the point where they're starting to research, okay, so if I do 5 times plasma, 4 times plasma, 3 times. So just thinking of the concentration, certain things respond better to higher concentrations of platelets. I wouldn't say that we're quite at the point in the equine side where we know all those different variations. So let's just say, for instance, that a ligament in my foot, or the horse's foot, as you guys were talking, I was kind of listening to talk, let's say a distal sesamoidean ligament responds well to 5 times platelets. Okay, well, we know that once we get that figured out, you just use 5 times platelets, because that would give you the best healing. Let's say that a stifle joint wants 10 times the normal platelets. Okay, so that's what we'd use. Right now, the machinery that we're using and the way that we're doing things, we just spin it. It comes out about 3 to 5 times the concentration, and we put that in. Sometimes we'll get some different variations, but that's been kind of the standard. Okay, actually, I'm going to go back. I'm just going to go back and make sure I kind of finish up with this. When we're done, when the questions come through, we can go over some different things with PRP. PRP for me is the pain relief comes from the healing. Okay, just keep that in the back of your mind. It's not a painkiller directly. There is some pain relief with it, but it's because it's actually done some healing or taken out some of the inflammation in the area that you've treated. Okay, the next one we're going to go into is IRAP. Okay. Interleukin receptor antagonist protein. As we get to that, this one is going to be more of a direct pain modulator. Okay, but if you look at it, it's just an anti-inflammatory protein that counteracts inflammatory proteins such as interleukin-1 that are produced within inflamed or arthritic joints. Okay, interleukin-1 has been researched a bunch in many species, and it's been shown to be one of the main players when it comes to osteoarthritis in the horse and many other species. Okay, so it wasn't a surprise when someone was able to kind of do the research, come up with a kit, and put it all together, right? And so what ends up happening is this receptor antagonist protein ends up binding so that interleukin can't express its inflammatory process, and then that just quiets down the joint. The more of these that we can turn off, the healthier that joint can become as far as pain goes. And there is a bit of regenerative effect as well. It's designed to stimulate the horse's own white blood cells, reduces the inflammation present as a result of degenerative joint disease, and IRAP treats the cause of joint disease and is in action. And its action is aimed at restoring joint lining and cartilage function. A lot of that comes secondary from a joint that's able to become normalized, right? If we think about homeostasis, which is the Latin term for just being balanced, in balance, right? That's what we're looking for when we use these regenerative therapies, is to try and get the body back into balance, right? Quiet down the excessive inflammation and get it to turn to a balance of normal physiology. IRAP, how is it harvested? Okay, so we're dealing everything. The three therapies that I'm going to talk about today have a lot to do with the blood system. And if you think about your physiology and your anatomy, basically blood is what carries it either takes the nutrients to your body, and it also takes the stuff away that you need to filter out through your kidneys, or it helps to, it goes through your lungs, and that's where you pick up your oxygen. Same with your horse, right? So how is it harvested? Blood is collected from the horse and incubated for 24 hours in special syringes that contain glass beads. What we're looking for here is surface area, okay? We just need those beads inside of that syringe or the casing in order for that blood to attach. And then if you put it at body temperature, let it incubate for 24 hours, what you're trying to do is, remember, if you think back to the slide before when I was talking, I said we're looking to shake or get a hold of those receptors. And so, oh, yeah. Is that better? Okay. Okay. So you're looking to get a hold of those receptors so that you can essentially stop that interleukin, right? And so if you only have 10 of those receptors blocked, you're not gonna quiet that joint down very much. But if I can get 1,000 or say 100,000 of those receptors turned off, now I'm getting some traction, right? Like this joint's gonna feel better. That horse is gonna have some relief, right? So that's the whole goal, is that we take whatever is naturally occurring in the blood, and then we're able to magnify it a certain number of times, right? Every horse is different. Some horses are really good at this, some are not so good at it. If you're looking in the literature and your different veterinary clinics do this, and there's no judgment here, it's just a matter of if you hear something said that they didn't use your horse's IRAP on your horse, it's because certain clinics now are starting to use other horses because they're so good at producing high levels of IRAP that they would rather use the donor horse than the horse's blood itself. We're definitely not doing that right now, and I'm not criticizing, it's just that from the standpoint of, I'm pretty comfortable taking your horse's blood, making IRAP for him or her, and then putting it back in. I'm not at a point where I'm comfortable taking it from another animal, even if it does produce more IRAP than your horse does, and sticking it in your horse. We're just not there yet, right? So let's come back to our slide a little bit. We talked about the growth, then he's induced the white blood cells present in the blood to produce and secrete therapeutic proteins. So that's just the ramping up or the magnification. As I was talking about the surface area, after 24 hours, the blood is centrifuged and the serum is separated from the red blood cells. This just allows us to take out what we want and to discard what we don't need to use for IRAP. When we split the protein-rich serum into separate frozen doses and freeze them for use at a later date. Okay, so we usually end up getting somewhere between 20 and 24 cc's per IRAP syringe draw. Your horse may only need 5 or 6 at that time. The beautiful thing with this is this can be frozen. We're keeping some of ours, 6 months to a year. Most of the time it's getting used up before then, but it's nice because you can harvest this once and then have doses to use later on to do maintenance, or sometimes we have to stack it a little bit. So again, if we come back to what I was talking about, I'm just going to use this as an example. Let's say there's 100 IRAPs inside of the stifle of your horse that are turned on, and I put in 5 cc's and it's got 20 IRAP in it. Okay, well, it's probably going to take me 5 injections to get up to that. And it's sad that not sad, it's just the way it is. We don't know how many are in there. So we usually try to inject in a series in order to get ourselves to the level. Once we've figured out what the level is, then we just stay on our maintenance dose from there, depending on how often that horse is being used and how quick the joint returns to abnormal function. Okay. The treatment. Okay, so 3 joint injections, 7 to 14-day intervals. I just kind of started talking about that a little bit ago. Target areas of joint disease and degradation. IRAP is useful after arthroscopic removal of chip fragments. Studies have shown that treated horses demonstrate reduced lameness, improved joint makeup, and tendency towards cartilage preservation. Again, these things are coming from the fact that we're using the horse's own natural healing factors to take them in a direction we want to go. When we use synthetic things like cortisone and hyaluronic acid, they do work, but they don't have the same preservation that the horse's own body does. IRAP does not increase the risk of laminitis, and there's a small risk of joint infection than with the use of traditional injections. So these are things that have come to light, especially I'm pretty sure Travis is going to talk about equine metabolic syndrome. Is that our it's our next one. And so in there, with this type of horse, some of these warm bloods, some of these older quarter horses, we see this this almost like, we've got a pandemic going on with COVID, but it seems like we have a pandemic going on with EMS too in horses over the last 5 or 6 years, like I've never seen before in practice. So the nice thing about IRAP is to this point, we've not seen any risk of causing laminitis. Your joint infection chances do go down with versus traditional injections, just because you're not turning off the immune system. When you stick corticosteroids inside of a horse's joint, you're actually looking to turn off the immune system, and that's why there is that risk with traditional injections. Okay, I'm just going to, before we go on to the last one, I'm just going to talk to kind of a little bit. This is a syringe where we're actually drawing the blood with a butterfly catheter, and then if I go back to this syringe, if you look down by the 10 and the 20 there, you can kind of see the glass beads in the bottom. That's how it's grown. Okay, and this is how we draw it here in this area, and then we end up incubating it for 24 hours with those glass beads that we talked about. Okay, now let's go on to the last one. Stem cell therapy. What is it? Stem cells are cells that have the potential to develop into some of the different specialized cells that make up body tissue, such as bone, muscle, blood, and nerves. Primary use is mesenchymal stem cells that differentiate into cells that form bone, tendon, fat, and cartilage. We inject mesenchymal stem cells from the bone or fat of a horse into areas with damaged tendons or cartilage. Okay, a couple of things to keep in mind. This is not new. Okay, they started studying stem cells, I think, in the late 60s and the early 70s in different human labs and horse labs. And so you kind of there's this whole smattering of what's out there, what can work, and is this a new thing? The new part is that it's become easier for us to do, right? And it's become a lot more available for horses. Before, for like the last 30 years, it's almost been a research type of thing. And we knew that it would work. I just don't know that there was the push out there. Maybe it was because big pharma was so involved, and not blaming them, or that's not some sort of thing where I'm picking on them, but maybe they just did such a good job of looking after things that we didn't really start to get into it. But with the move, the kind of the new age move, we've seen where humans are looking for ways to heal their body without using chemicals. And we've started to see that happen in horses. It's just kind of a parallel system, I think, where if we're doing it on ourselves, why don't we try and do it on our horse? Sometimes we do it on the horses before we do it on ourselves. And I think stem cell therapy from a treatment standpoint has really jumped up. The 2 places that we have enjoyed the most success for it have been stifle injuries, so meniscal tears or damage inside the stifle, and then proximal suspensory ligaments. We've used it for other ligaments too, and I like it. It's just that the biggest thing is that if the client can see value, then they'll do it. This therapy costs quite a bit more than the other 2 therapies, or the other 2 therapies. So it's just always a challenge to make sure that we invest your money appropriately. So sometimes I think PRP has become the therapy because it's got a better price point. You can do the shockwave with it, and you can treat several times. Stem cells, what's nice about them is they really do have the potential to differentiate into the cells that we're looking for. And they work for up to 6 months afterwards, right? I think that's the big thing there as well. Anything else I can add there? There's also a really nice soup around them. stem cell extracellular stuff that we talk about. So there's been some labs that have actually done research on that soup that comes with the stem cells. And some people think that the soup is as important as the stem cells themselves. So when we harvest, we get that little bit of extra stuff around there that comes with the stem cells. So we don't want to forget that as well. If you're looking in the research, you'll see some stuff where there's different things where people talk about the associated growth factors that come with stem cell therapy, and wondering if that's not as much help as the stem cells themselves. How is it harvested? So a couple different things we want to talk about. You can get in an argument. Definitely not going to argue today over bone marrow versus fat. And then there's the ones harvested from umbilical cords, right? And if we're looking to the future, I would say the umbilical cord ones are going to really come to the prominence. And you'll see out in, especially in the United States right now, there's a couple of companies that have jumped up over the last couple of years. I don't remember the names of them, but you're going to see them on the forefront where they're actually harvesting stem cells from umbilical cords that have been gathered up from breeding farms as foals are being born. Again, if you're doing that, you're definitely open to the fact that they're allopathic, right? Like they're not your horse's stem cells. They came from the most viable place to get them, which is in a developing fetus, right? So the placenta is a great place to have those stem cells because they're at a really, really sweet spot in their life where they can really do a lot of growth and fix a lot of things. Again, you just have to be okay with the fact that it's not your horse's stem cells. The other two ways, the bone marrow and the fat, just means that you collect from your own animal. Then there's a couple places in the states, Texas A&M, Colorado State, and then VetStem is still in California, where you can get, once you harvest the stem cells, if you send them off, they'll actually grow them up, and then they'll bank your horse's stem cells. And then if you need some, you just get on the telephone or send an email, and you can have them grown up or sent to you, right? The quickest way, and the reason that we kind of bought into the system we did, is we use a system where we can come in and you can see the finger in the groove there, where we can actually draw, within 4 hours, we have 15 million stem cells to put wherever we want. You can't harvest, repeatedly without some time frame between them, because the fat needs to be replaced in that area. But they do have two hips, right? So this is the left side, which is the normal. We usually start with the left, and then if we have to harvest, we harvest on the right the second time or whatever. What's nice about it, as I said before, is you get very fresh stem cells. You get your own, you definitely get the horse's stem cells, and it can be done in a day, right? We don't have to send it off the US. We don't have to worry about the border crossing, the growing of them, and then trying to figure out all the regulations that go with it. The bone marrow side of things, at this point, everything is done through the US. So you'd harvest the bone marrow, and then it gets sent down. If they grow it up, it takes anywhere from 3 weeks to a month, and then you have your stem cells back. At that time, a lot of places will save them if you ask them to, and then you have what's called a bank in the US that you would call that to get your stem cells from. The treatment, we inject the stem cells directly into the injured tissue, either through ultrasound-guided injection or regional limb perfusion. Studies have shown positive results in tendon and ligament injuries, including better alignment of fibers and less disorganized scar tissue. Lower rates of injury after stem cell treatment. I think the biggest things for us is that when a horse is put through the proper regenerative therapy program. Okay, so I'm just going to kind of come back to PRP, stem cells, and IRAP. When you're using these, just keep in mind that it's not going to be, sometimes it's not going to be as quick as cortisone or traditional therapies where you inject into an area and there's an anti-inflammatory response right away. They are a little bit like pulling back a slingshot, right? Like as the rubber band's coming back, nothing's happening, and then all of a sudden when you let go of the rock, it's propulsed, right? So you got to keep, I have to say this to myself every single time. We'll do a set of injections on a horse, and the very next week, the question comes when's my horse going to be better? Well, it's going to be better once that tissue is healed, and that tissue could take anywhere from 3 weeks to 3 months. I think the biggest thing that we're putting together, and you can kind of see how we parallel this today, is the rehab. Once that tissue has been put on a healing trajectory, Then the question becomes is how much do I challenge it, right? And if I challenge it too much, well, then I'm re-injuring it all the time. If I don't challenge it enough, I get a scar, okay? And the girls did, I think, a brilliant job of kind of going through the delicate balance. And I don't think that we have it all dialed in at the moment, but we're getting closer. And over the next few years, I think equine sports medicine is really going to get its finger onto it because it's a very big focus at the moment, right? So using these regenerative therapies to treat these injuries and then having a very good rehab program on the back, we'll see our success go up with your horses across the board for all veterinarians. Definitely that's where we are focusing a lot of our attention at the moment, as you know. So, okay, questions?
Okay. All right, so we've had a couple already come in, and then I have a couple from before as well. So Chad, at what point do you choose to use PRP over a general joint injection, or do you have to use them together?
Okay, so okay, question is, okay, it's gone now. Okay, so the question is when would I use PRP versus a regular injection? I think, is that correct? Yeah. Okay, so a couple things to keep in mind is PRP is can be deactivated by the use of steroids at the same time. In some human labs, they're so careful that they won't even allow you to take an aspirin or any kind of a non-steroidal for up to 30 days before they do the stem cells or the PRP treatment, and they don't want you to use it for 6 months after you're treated, okay? Because they think that it has a inhibitory effect on the PRP and what it's doing as far as the healing factors. I think we may more in this, and I don't mean lax in a negative way, but I think we tend to think of horses as having the ability to heal. So we tend to not use steroids and PRP in the same appointment. We tend to be, if we have a ligament injury, we're going to use some PRP in it. If I'm going to use it in some joints, I do that same thing, but I wouldn't use any steroids that day. I would use that. Definitely we use IRAP and PRP in the same appointment pretty regularly because the IRAP has no effect on the immune system in quieting it down. If anything, it's trying to step it up.
Do horses ever reject stem cells?
Okay, so in our experience, no. And that's because like I said before, we're only using the horse's own stem cells. I do know that when you use stem cells from another animal, as even platelets and even IRAP, there is that risk, right? And I think that's probably the reason that we've been so careful is we would like to not see those rejections. Definitely, you're going to see more and more what we call allopathic, allopathic, where you're going to see there's a donor horse that gives really good stem cells, gives really good platelets, gives really good IRAP, and so we're just going to see companies try to purify that and put it in a bottle, and they're doing it already, right? A lot of hospitals have donor horses for their IRAP, and they just use the IRAP from that horse. Stem cells are no different at this point. And the umbilical ones we were talking about, and I can see why we're reaching for it, and I think in time it'll come to Canada where we'll have the umbilical ones as well.
Okay, so the next question is, are the stem cells from bone marrow better than from fat?
Yeah, great question. So I'm going to just go through a couple of arguments here real quick, and you can kind of form your own opinion. The bone marrow stem cells have been touted in several laboratories as the best stem cells out there, and the fat has been touted in certain ones too. I'll go through a couple of the pluses and the minuses. The plus of the bone marrow is that once you have it harvested, and we talked about it, once they start growing them, you can have unlimited stem cells. So you can get as many millions or billions as you would like, right? One of the things that you'll see is the counterpart of that is that they're often grown on some sort of sugar media, okay? And sugar is a problem with cancer. And so stem cells and cancer are really not that far apart. So you'll see the argument back there. I'm not saying that's right or wrong. I just want you to know that that's part of it. The fat stem cells, the big hindrance on them is that if you're harvesting fat and you're using it, You're not growing up new stem cells. You're using stem cells that are already in the horse's or the human's body, and they may not be as healthy as new ones, right? And you can't grow them per se at that level, right? I think the jury's still out. I would say the one that's probably going to take the lead, if I was just kind of reaching out to look at the future, is going to be the umbilical ones. Everything that I read and the stuff that I see in the human literature as well as the horse literature shows that they're pretty cool, because they're baby stem cells. They're healthy. They're very pluripotent, which means that they are at a spot where they could grow into anything. Even the stem cells that you see in fat and bone marrow in a mature adult horse or human or dog or whatever, they've already kind of been placed into a certain spot, whereas those ones in that umbilicus or that those baby stem cells, they haven't. And so when I put them into a ligament, we think that they can help that ligament more than a mature one can.
Yes. Okay. So Kim had asked the question about PRP over general joint injection. She missed the answer, but I think she has a more specific question, and that's, when would you choose PRP/IRAP over a steroidal joint injection?
Okay. There's which Kim? Kim. Okay, sorry. Anyway, it's so good. It's good. We have several Kims in our practice. So, a great question. And if anyone's ever been to an appointment with me in the last year, maybe the last 3 years, you always hear me say, if it was a perfect world. Okay. So if it was a perfect world and money wasn't a concern and time wasn't a problem and everybody lived 10 minutes from me and I could do everything that I wanted, I would move to a mixture of PRP and IRAP together. Okay. And I would use hyaluronic acid. And the reason being is that anytime that I'm using the horse's own body to heal it, I think I can reload way more. And I think we're going to be able to see things to where therapies will last longer. If they don't last longer, we could re-up without the concerns of the laminitis. And anytime that I'm putting these two factors in there, I'm actually trying to heal the horse, right? I'm not just trying to quiet down the inflammation. I'm actually trying to do things through a healing process, right? So I'll just make that as my first qualifier. Okay. Now let's come back to the world we live in. Okay. I just ran on Sunday and all my friends are up again on Thursday and Friday. I'm trying to beat them. Okay. Plasma is not your friend. Okay. It is a great product, but it's not going to heal that horse by Friday, right? When I stick a little bit of triamcinolone and a little bit of depomedrol in there though, you can ante up on Thursday and Friday and beat your friends, right? Like that's a game we're going to be playing, right? And so we have to kind of look at what we're looking for. I'm not criticizing cortisone hyaluronic acid. We use a lot of it in a really respectful manner, and we feel that it's a great treatment for horses that are mature and have issues and quiet things down. I feel like if I go back to the talk that the girls gave, everything that I'm talking about from the stem cell, PRP, IRAP, and then even all the cortisone stuff, we're just looking for horses to return to their normal biomechanics, right? Just think of yourself. If you're not moving in the proper form or proper way, then you end up injuring yourself more. And think of that compounded times 2, because you're walking on 2 legs, your horse is walking on 4 legs, and it's got a lever arm that's about 3 feet long with like a 65-pound pendulum on it, right? And so as you start to kind of put all those things together, that's the balance, right? Is how do we get the relief that your horse needs in the time frame that you're looking for, with the ability to operate with inside of these regenerative medicines, right? If time wasn't a factor, money wasn't a factor, the IRAP and the PRP and the stem cells, that's all we would use here with some really good hyaluronic acid from a joint therapy standpoint.
We have some really great questions coming in. Are the applications of these therapies as promising with a chronic or degenerative condition such as DSLD versus an acute injury?
If I speak to people with DSLD,
What is that?
Degenerative dispensary ligament disease. Okay, so if I have a horse that has that syndrome, I feel bad saying this, that's a one-way road and it's never fun. Does that make sense? Like, I think using stem cells plasma and shockwave and anything you can do to help that is really key. Also, I'm going to go out on a limb and talk a little bit about nutrition, because I'm not going to get in that rabbit hole, because Louise already warned you that I love to talk about the gut, and I love to talk about the things that we can do. But I wonder sometimes if we don't see that coming on in these horses based on the chronic inflammation coming from the gut, and almost like a leaky gut syndrome, where these ligaments become degenerative over time. My experience with that syndrome is that we manage it the best we can. It is a one-way street. That's not. I haven't seen anything that's going to take us away from it, unfortunately. The regenerative therapies will slow it. They just can't stop it.
Okay. Dodie, who always comes to all of our lectures, says, are PRP and IRAP used for maintenance also, or mostly for injury recovery?
Great question, Dodie. Hopefully the sun's shining in Nanton, Alberta today. So, coming to go back to that perfect world, we're starting to see with the Angel, because the Angel system that you saw there, we can draw anywhere from about 100 to 250 cc's of plasma when a horse comes in, and then we can bank that and freeze it. So some of our clients have been using that as a maintenance. Like I just did an old warm blood horse yesterday that has chronic disease in its pastern disease and coffin joint. It has low and high ring bone. So we put that in there, and we're going to do it again in a couple of weeks. So we're using it as a maintenance. That client's very solid on wanting to use it, on using non-steroidals. The horse has some ulcer problems, that sort of thing. As these therapies become more and more mainstream, I think we'll see people using them more and more as a routine maintenance or preventative versus just the treatment of chronic injuries. Right now, they've been kind of reserved for that because of the price point.
Okay, another great question. If you are using IRAP, what would an appointment look like? Would you have to keep the horse there for 2 to 3 days?
Yeah,
One second.
great question. We get horses that come in all the time, and people are quite interested in the IRAP, and that's what I was meaning about being 10 minutes away. IRAP is 24 hours, so we prefer that if we can, we'd like to either see the horse ahead and harvest the IRAP, or we have to see them afterwards. The plasma, nice thing about it, it can be drawn and spun down. If it's just our regular system, our Arthrex, sorry, the original Arthrex system, it takes us about a 15-minute lead time to get things prepared, and then we inject it that day. But the IRAP is, unless it's frozen, is always a draw. A lot of our clients that are buying into the IRAP, what they're doing is they'll just have us come out before spring hits and have us just harvest. Like I'm going to go harvest some IRAP next week on a horse that they probably won't use it for 3 or 4 months, but they know they're going to want to use it when they want to use it in a horse that's got a problem. And this is another thing that we do here is we try not to lie to ourselves. Once a horse has a problem, it's probably a problem, right? Does that make sense? Like if I've got a pastern that's not getting better and it's got some arthritic changes in it, I don't tell myself I treat it once, oh, it's all better. No, that's not going away. So this client knows there's a couple of things with this high-level dressage horse that if we keep it tapped up, right, meaning that we keep it pain-free, the function stays good, and it just keeps climbing the levels, right? And they're trying to make it to Grand Prix with this horse. So as it goes through those levels, these couple areas that we have to treat on a regular basis, that's the limiting factor. So I think those are things that are nice about IRAP is that it allows us to get in there, help that horse out, because that problem is not going away. I mean, a lot of these horses are very well conditioned and using their biomechanics appropriately. They just have a weak link, right? As we all do. I got a knee and a shoulder, right? So, and the more I take care of them, the better my CrossFit goes.
Okay, there's a couple more here. Is there a limit to how many times you should use PRP? I have a gelding that had it for a DDFT tear, and I think it truly helped his healing and strength immense.
Yeah, that's awesome. We have enjoyed a lot of success with deep digital flexor tendon problems by using IRAP, using PRP. We've used IRAP too on some of them, but the PRP has really been helpful there. We have kind of paralleled with the human literature. There'll be more PRP literature coming out. just keep in the back of your mind that the reason that big pharma is able to enjoy the success that it enjoys is because they have, when they're putting together products, they get money to do research, right? So if you look at the PRP, the only person that's making, or I shouldn't say this, the only group that's going to benefit from this is the manufacturers of the kits, right? Well, the kits don't need to have any literature done for the horse side. The human side is so hot that they're doing all the research on the human side. So we've been using a lot of our treatment protocols are based off of human stuff. There's going to be more horse stuff over the next little bit, but we do 3 treatments. We do them anywhere from 7 to 14 days apart. And then depending on how that horse does, for soft tissue injuries like a deep visual flexor, you may do that later on, but usually we're trying to see if we can get those to heal pretty nicely with those 3 treatments and an appropriate rehab program, right? Especially DDFT.
I think I have 2 more and then we'll wrap it up. For a navicular horse, would PRP or IRAP be beneficial, together, separate, etc.?
Okay, we have used a lot of PRP in navicular horses. I had 2 barrel horses last year that were injured towards the CPRI ones, the really nice ones, and they both ended up with some PRP treatments in the fall and a little bit of shockwave. Because the season wasn't going to the client's liking, they were able to take those horses out of performance, and I think that's a big part of it if I'm working on a navicular area with a soft tissue, because we don't always have MRIs. Both those horses didn't have MRIs, but we knew they had soft tissue injuries in their feet because the radiographs were normal and the horse blocked to that area. So we treated the best we could as far as depositing PRP in that area, and we just leave those horses off. And then we started them both back here recently with some rehab programs to get through it. So I like PRP for those injuries down there because it does the healing, especially if I've got a fresher injury. I think that's the thing to keep in mind is anytime that you tear or injure a soft tissue, the more you wait, the less your chances are that we can get there. Because once the scarring's in place, it's a little bit hard to take it out. IRAP down there, yeah, we use a lot of IRAP in navicular burses, and we use it in coffin joints, and we like how it works there as far as pain relief goes, and maybe those more chronic cases of navicular disease.
Okay, last question. Why does it seem like we've moved away from Prolo injections along with these regenerative injections? So maybe just touch on first what Prolo is for people that have never heard, and then why it seems that we have moved away from them as a treatment.
We still use Prolo. Every stifle that I blister, every whirl bone that I inject gets Prolotherapy. I moved away from, I used to use iodine and almond oil. We still use it at the odd time, but any of our blister therapies are still Prolotherapy. I still like the Prolotherapy. I think over the last few years, even if you went into the human side, IRAP and PRP fit in the Prolotherapy category. They're just not the traditional stuff. I also feel like the areas that I use Prolo in, it's because I can get. And then.
That's okay.
Okay.
You're still on.
I'm still on?
Yeah.
Oh, okay, sorry. This whole technical thing. Now I'm looking at a black screen because I just touched a button and turned everything off. So my wife would say I like to talk to myself, so this will work out just fine. So coming back to those Prolotherapy thoughts, the IRAP and the PRP in the purest sense are Prolotherapy, right? I believe that as we've seen these new modalities kind of come on, even in the human field, if you go to a naturopath, they're using a lot more PRP than they were a few years ago, just because there's such a boost in the healing that you get from it. We still do quite a few Prolotherapy injections. I still like it in our practice, and if people are keen to do it, we'll still do it for them.
Between 1 and 90.
77.
Okay, 77. I'm gonna count that after we get off this and do a bathroom break. But number 77 on our list. Oh, I'm not unmuted. I'm an idiot. My help I mute myself. So number 77, I'm gonna do a quick count. So you guys better stay on, or else you're gonna shift around. Gets a 4-liter jug of Equiflax. This is our new flax oil that we have. It's exclusive to Energy Equine. It's a great product that Dr. Hewlett loves and he recommends all the time. Very high in omega-3s, so great anti-inflammatory properties and really good for skin and hoof condition. Also just a really great supplement that's a lesser price point to add on to your supplements or grains that you're already feeding. And then we're also going to throw in a fun Core Balance hat. This is the supplement line that is also exclusive to us in Canada. Everyone that knows us knows that we love it. There's formulas for training horses, horses that are developing, brood mares, and then there's some added extra supplements that include amino acids and hyaluronic acid. So really great supplement line, a great oil product that we've just started carrying. I feel like Vanna White. So number 77 on the list is going to get that. I will do that counting now and I will let you guys know in the comments who that is. Next up is Dr. Travis Kelter. We're going to do another quick 10-minute break. I don't know where Travis is, and if any of you know him in real life, he can be a little scattered. So again, Jesus, take the wheel. But we're going to get his presentation up on the other laptop.